Today we're going to be talking about pandemic fatigue and resiliency.
With her, but she was like having mental health issues. So
I think we're all frustrated and tired from the more than 2 years of the pandemic now. And so, the toll that it's taken on our mental health, I think people are worried and concerned that, it's impacting our short-term and long-term mental health. So today we wanted to bring some experts together to talk about, what pandemic fatigue looks like and whether or not we really can build up resiliency from this experience and what that looks like as well. So we have with us T. Cowley, who is a resident at Huntsman Mental Health Institute in psychology, and Dr. Kristen Francis, one of our psychiatrists at Huntsman Mental Health Institute. So thank you both for joining us. And Kristen, we're going to start with you. I'm going to ask you both questions. We'll also be moderating questions in the chat. So if any, and also through our Facebook page. So if people have questions, we'll be able to ask those kind of on the fly as well. But we'll start with Dr. Francis. Tell us a little bit about what pandemic fatigue looks like. How do we know we're experiencing it? How does it impact you?
Yeah, great question. We're seeing a lot of people with a variety of feelings. So extreme feelings, big feelings of a lot of sadness, depression, just exhaustion, and a lot of anger-based feelings, frustration, irritation, and just normal anger. We're also seeing increasing amounts of apathy. So people who are just tired, they're tired of wearing masks. They're tired of limiting their social interactions. They're tired of their lives being changed and not going back to what was, normal 2 years ago, and what is a lot of anxiety and fear of what the future might be, what the new normal might be. Is this the new normal? Is this the way it's always going to be? So frustration, anxiety, exhaustion, apathy, those are all feelings that we're seeing that people are experiencing right now. A lot of grief as well. Many people have lost someone during this pandemic, or multiple people. People's lives have changed. Their livelihoods are different. Their homes look different. Kids are being schooled in a different way. So a lot of things of feelings of just feeling overwhelmed. I think it's good to be asking yourself a lot of check-in questions about how you're feeling. Are you feeling any of those feelings? Are they different from what you normally experience? Are you able to feel the other feelings that we often feel? Happiness, joy, a desire for connection, enjoyment of previously enjoyed activities. Are you finding meaning and purpose in your life? And that's a good way to kind of look and see how you are. And then also just checking in to see what your life is looking like. Are you able to find ways to cope and to get around some of the barriers that have been there? Or are you more just increasingly staying at home, isolating, even when there are opportunities for socialization in a safe way? Are you finding that you're short, irritable with your family, coworkers, your children? Has your health changed? Are you moving less? Are you eating differently? Are you using substances more to try to cope and feel better? Is your sleep changed a lot? I'm outside today. Are you not, moving outside and being out in the sun as much as you can? So those are all things that we want you to start asking yourself and looking at your daily life.
If people are experiencing, having some negative thoughts or feelings, what are some ways that they can cope, or things that they can do to improve their mood or cope with some of the feelings that they're having?
Yeah, so first and foremost, acknowledging your feelings, accepting them, not feeling embarrassed or ashamed. If you are feeling frustrated and irritable, we understand that. I mean, that's normal, and everyone is having a myriad of those kind of more negative feelings. We recommend that you start to try to move your body. So movement is helpful in that it releases natural endorphins, helps improve your focus, improve your overall mood, as well as your sleep. We tell you to get outside, get in the sunshine. There's a lot of evidence that sunshine directly impacts your well-being. Here in Utah, we're lucky to have a lot of sunny days. And so if you can get up and it's not inverted outside, if you can get out of the inversion, so you move your body around, even if it's just at home doing chores, activities. If you can get outside, that's great. Paying attention to your sleep is really important. A lot of people don't realize how much a lack of sleep or a lack of restful sleep impacts them. Can totally make you irritable and tired the next day, and more likely to be sad. Also affects your eating habits. So looking at foods and making sure that you're picking a variety of foods that you're enjoying while you're eating, that it's giving you nourishment in addition to enjoyment. And then we also want you to really be looking at your substance use. So most mood altering substances can feel good in the moment and often can lead to longer term complications, like, alcohol can worsen depression. Marijuana can definitely impact your focus, energy levels. So paying attention to how much you're using substances and being mindful of their impact on your well-being.
Thanks, Dr. Francis. Teague, let's move to you and ask you a little bit about resiliency and how do we define resiliency? What is it and what isn't it? I think we've heard that term being used a lot in relation to the pandemic and traumatic events. Maybe you can tell us a little bit about some of the research that's out there and what we know how the pandemic has impacted people's resiliency.
Well, thanks so much for that question. I think this is a great opportunity to have these types of conversations, where as a society, we're struggling a lot with our sense of resiliency and our ability to carry on through these difficult times while we're struggling with the pandemic. I think often resiliency is seen as this ability to avoid difficult experiences or to minimize those experiences. But in reality, resiliency is not necessarily the act of avoiding those things, but in reality, just experiencing those difficult experiences and then having the capacity to sort of bounce back from those difficult experiences, right? And I think it's important to recognize that it's not necessarily the avoidance of those experiences, but actually being able to experience them and move through them and being able to return to those things that we enjoy, right? Understanding resiliency is really critical as we as a society, right, sustain ourselves through the pandemic.
And what about for people who are maybe on the front lines and having, more traumatic experiences right now? What does it look like? What does resiliency look like for them right now? So, and what do you know from past traumatic experiences?
So resiliency for our first responders, our medical providers, is a way of life, right? They often are dealing and managing through difficult experiences every day, right? The pandemic has brought in a new complication where, those that provide those essential and needed services are struggling on a new level, right? Where not only are they perceived with a possible stigma, right? Because they're in those sorts of roles, they also have to worry about their experiences at home, right? And the way that they protect their family from the way that they provide services to others. So it is a multifaceted, complicated experience where those that take care of us have to worry about themselves and their continued ability to provide those services to others, but also in the way that they protect their own families. And so for that reason, it's really complicated for those people. And it's really a lot more onerous for those that provide those necessary services for us to have someplace to go when we're struggling and when we're maybe a little sick or when we actually get diagnosed with COVID-19.
Dr. Francis, do you want to comment on resiliency as well?
Yeah, so resiliency, again, that ability to kind of bounce back from hardships and how to the ability to endure experiences and thrive despite it. So that's such a good term. It's kind of mental toughness. Someone recently was talking about mental antibodies, which I loved. the term of that. But building up your mental toughness, your ability to be bounce back. We're seeing a lot of providers talking about exhaustion and emotional fatigue as well as physical exhaustion. You know, some of the people in the ER have been going at this in ICUs for years now. I mean, literally years, when our bodies are really physiologically not meant and not equipped really to keep up with that amount of stress for that long. And so we're seeing a lot of providers reaching out right now for support. At Huntsman, I see patients for urgent consults if they need a psychiatrist evaluation. And we're seeing a lot of people reach out and access that service, which is so great. People are talking about maybe starting a medicine, which they've never done before, to help kind of boost some of those serotonin levels in a way just to get them through this next push. I'm talking a lot about targeting sleep and their movement, nutrition, but a lot about community and connection. So we're seeing providers reaching out to each other, talking about the importance of just being able to vocalize their experiences, their COVID stories. So providers sharing their COVID stories with one another, validating their own experience by hearing someone else's and realizing they're not alone. In fact, their feelings are shared by others. And so we're seeing so much relief, I think, with that ability to talk about their experience, have someone else say they have similar experiences, similar feelings, get that kind of bolster of connection, and then kind of that push to go back out and rejoin the effort to serve our patients and each other. So seeing a lot of people that are tired and really working to bounce back actively.
Thanks, Kristen. We have a couple of questions. So first from KSL, how will people know when it's time to take action if they haven't had mental health issues in the past? And what is the first step? Dr. Francis, do you want to answer
Yeah, that's a great question. So that's a really common place I think a lot of us are finding ourselves at. So we're seeing people who've never had a history of anxiety or depression who are now seeking mental health support. And that is awesome because it is not a sign of weakness. It is a sign of strength to ask for support when you need it. So people are like, how do I know when it's time? You know it's time when it's really impacting your life. Your mood is getting in the way of your life. Your habits are getting in the way of your life. Your relationships are suffering. Maybe your work is suffering, your productivity, your off time. So maybe you're not rejuvenating and regenerating on the weekends like you want to. When your life is starting to be really hard in ways that are just ongoing, we want you to seek help. That is when it is time, is when you're not bouncing back in your everyday like you normally would. And multiple areas of your life are being impacted, especially if you're starting to have thoughts that this is just too much, life isn't worth living, you can't keep going, you're not sure how much longer you can do this. All those thoughts mean it's time. And it's time, and we're here. There's a lot of professionals that can help guide you in quick, effective ways. This is not going to be an ongoing, lifelong, you're going to have to lay on a couch multiple times a day for years and talk about your feelings. This is stuff that we can really quickly intervene on. So the first step is acknowledging it's time for help. Then we ask that you go online. There's great resources. HMHI.org has a whole list of support services. So there's a 24/7 crisis line. There's an assessment center 24/7. You can make an appointment or take a walk, come in, walk in, and we can help assess you and see what services you need if you're in crisis. Also, we have outpatient services. We've got inpatient services. We have day treatment for young people. So there's a variety, we have a substance use support services. So there's a variety of services that we have. Online is a great place to start. Also, your primary care doctor. If you don't have one, you can still reach out. They usually have same day or soon day visits for people who are in pretty big need. And they can get you set up with a referral to a mental health professional after an evaluation if they feel like you need one.
Thanks, Dr. Francis. Teague, let's go back and talk a little bit more about maybe you started talking about resiliency a little bit, but let's expand on it just a tiny bit and talk about what post-traumatic growth is versus resiliency. Before this conversation, you started explaining it to me, and I think it would be a helpful part of the conversation, if you don't mind.
Absolutely, absolutely. And I think it's important to understand the distinction between the two. Resiliency is a great and important thing that we all have. I think that some folks have developed strong resiliency and some maybe not so strong, right? But I think what's also important to understand this term they use a lot in the research called post-traumatic growth, right? And post-traumatic growth is the difference between resiliency, which is this idea of snapping back to how we were before these traumatic experiences, and post-traumatic growth, which is actually a process of realization and change and integration, right? And that's a positive change that can occur. I think that oftentimes we have a discussion about the pandemic and the negative impacts that it might have on the individual and on culture and on society. Well, post-traumatic growth kind of reframes that picture, and it looks at why and how we might better understand the benefits, the things that we learn from the pandemic as we move through it, right? As we try to do our best to protect ourselves, our loved ones, and to work, right? And post-traumatic growth allows us to integrate these difficult experiences and to make positive change as we integrate these difficult experiences and difficult feelings, right, for the better. And I think it's important to try to always look and think about it in that way and in that light, because as much as there's always going to be difficult experiences as a part of our life, right, I think it's important to stress upon these experiences and upon ourselves that there can be positive outcomes from these experiences. And it's important to understand those experiences and to highlight them, because we can be bettered from these difficult experiences. Does that make sense?
Yeah, Dr. Francis, do you want to add anything to that?
Yeah, Dr. Kelly, correct me if I'm wrong. It sounds like you're talking about not just bouncing back to kind of how you were or are, but even growing to a new normal, accepting a new normal, and learning things from your experience and changing, adapting almost. Is that correct?
Yeah, absolutely. It's about the integration of these difficult experiences and the lessons that we all learn, right, as ourselves, right, and as a society. I think that there's a lot of great things that we've been having as a discussion to help individuals, survive these difficult experiences, right, and to benefit, right, and to improve. We talk about building resilience, right? This is where post-traumatic growth can come from. We talk about how it's important while we try to build that resilience to prioritize relationships, right? To prioritize those relationships in a way that we focus on quality over quantity, right? We try to set realistic goals for ourselves as we, try to metric our performance, our improvement, our quality of life, right? We set goals of, say, hey, I want to try to go for a walk a couple times a week. That'll help me get outside. We try to set self-discovery through reflection, right? We think back on positive experiences that we've had, right? We try to keep things in perspective, right? That maybe today might be a difficult day. We don't feel as connected, but we also recognize that it's going to be better tomorrow and that it can get better, right? But these are all lessons that we can learn and integrate within ourselves and make these difficult experiences and feelings help us improve.
Got it. Yeah, I think I've been hearing stories of that, of people who have looked back on previous times that have been really hard, and they realize now that they're not in that same situation, and they're not that same person. That experience profoundly changed them, and for the better, often. So over time, they found that maybe they see the situation differently, or they learned a new skill, a new way of coping. So maybe they learned a new activity or hobby to help them when they're feeling overwhelmed, or they're experiencing grief. So people who have lived through traumatic experiences are often able to then handle the next ones that come with some new perspective, some new ways of thinking, if they've been able to grow from that experience, right? I think that the worry we always have is that maybe someone is undergoing trauma and then avoids afterwards, avoids learning from that experience, learning how to manage those big feelings and areas that come of pain that come from that. So we want you to know that there's help to overcome some of that pain you're experiencing, and to be able to not be paralyzed by it in the future.
Thank you both for that insight. I think we do have another question that's somewhat related to some of the things that I think Teague was mentioning. Are there other things or at-home therapies or things that people can do to beat this overwhelming pandemic fatigue, ways of sort of managing these overwhelming thoughts, or ways that, aside from some of the things, Dr. Francis, you mentioned before, by moving our bodies and eating healthy, kind of going through a thought process that helps sort of manage those uncontrollable emotions that may overtake us. So I'll let you comment first, and then we'll go back to Dr. Kelly.
Oh, let's start with me. Great. Yeah. So I'm very practical. I like to have, things to do. I don't just like a lot of theories in my everyday life. It just doesn't work for me. So there's two kind of therapies out there right now that we're really focused on. They've been around for a while, really great evidence base. Acceptance and commitment therapy, or ACT, acceptance and commitment therapy, and then DBT, dialectical behavioral therapy, DBT. So basically there are two different types of therapy that help focus on how we feel and what we do to help ourselves feel better. So in DBT is a really good therapy that you can Google, and there are things in the moment that you can do to actually help yourself feel better. So these are things like temperature change, so changing your temperature quickly, either immersing your face in ice cold water, which sounds surprising, but it's actually really shocking to your body and helps spur a reflex that makes you feel more calm. Intense exercise. So suddenly when people say, drop and give me 20, I always think of this one, doing something really fast in the moment and really feeling your body respond to exercise. Paced breathing is another technique. Some people find that breathing is really helpful for them. And there's different ways of doing it so that you're not just like, it's really some guided ways of breathing. Those are really good skills that you can do in the moment to feel better. And then progressive muscle relaxation. So some people really tense up their muscles and then progressively relax them throughout their body. Those are things that you can do in the moment to help yourself feel better, that are safe and effective. There's also some really good studies in ACT therapy on mindfulness. So practices you can Google online about how to become aware of your environment, listening to what's going on around you, naming things you see, what do you smell, what do you taste, and really bringing yourself to the present moment to focus on what's happening in the here and now. That practice often moves into acknowledging your feelings. Just even naming your feelings sometimes helps you feel better. Oh man, I'm really frustrated right now. So naming your feelings, having a non-judgmental or non-shaming approach to it. So I hear a lot when I see patients, a lot of shame around negative feelings. And negative feelings are just an everyday part of all of our experience, and people think they can just push them away or avoid them, and you can't. And by acknowledging them, accepting them, and being like, neutral, like, I wonder what's got me frustrated, curiosity about them, that's a great way of starting to move from mindfulness, acceptance of your feelings, acknowledging, accepting your feelings, and then you can focus on making decisions that either kind of align or move you closer to your goals and your values, or maybe decisions that don't move you as close. And so there's some really good therapies out there that you can search for and start implementing some of the techniques at home. You also can have a therapist who can support you in some of these techniques.
Thanks, Dr. Francis. Dr. Kelly, do you want to comment on that as well? If there's...
Absolutely. Yeah, I have some great things that I jotted down in preparation, just some ideas that people can use. I think that there's a lot of different social interactions that we can sign ourselves up for: volunteering, for civic groups. Faith-based communities are really helpful to connect with new folks in our lives. Right. I think that we also talk a lot about self-care, right? But what is that? What does self-care really mean? Because sometimes self-care can mean good nutrition, having a good diet, right? Simple things, having both high quality and quantity of sleep, right? Those are two different aspects of sleep that are very important, right? That we get enough sleep, but that sleep is both of high quality and consistency. Hydration, simple, right? But really important. Regular exercise, and exercise, can be all sorts of different things. It can be go for a walk. It can be, maybe something a little bit more intense, like a spin bike or something like that. And then we talk a lot and we stress a lot about mindfulness, right? And so one of those things that I think is really great is mindful journaling. Okay, so there's a couple different ways that you can do that, right? Because when we typically think about journaling, we think about talking about the day's experiences and our feelings, right? And what happened that day. But mindful journaling can also consist of, reflection, like recalling a positive experience that you had in the past. What happened? Why was it a positive experience? Who was there? What was significant about that time, right? It's about recalling and reveling in the positive aspects of those experiences. That can really be beneficial. And we often talk about that in therapy, about how do we recall those feelings and experiences in times that are not so positive, right? Spiritual practices, so like meditation. A lot of people benefit from prayer, right? These are things where they can connect to a higher power. It's just really a significant thing for a lot of different people. We want to try to avoid negative outlets, okay, and negativity, but we also want to try to avoid unhealthy coping practices, right? And often, and this has been mentioned before, we want to be careful that we don't try to manage and cope with difficult feelings through substance use, right? Not only is it unhealthy and it's not good for us, but it also prevents us from building resilience, right? Often when we lean on those substances, right, it prevents us from using those healthy coping skills that are more effective and better for us. So these are just some ideas. There's a lot of different things. And the most important thing is to understand that a lot of times it's about figuring out what works best for you, right? That this is a trial and error process. And some of these things are going to be more effective for some people, and some are going to be different for others. And so I invite everyone to try something new and find what works for you, because that's the most important process. We're all in a journey, right, to become experts of ourselves. And this is part of that journey.
And I think we've heard a lot that now is the time to prioritize our mental health as we're all going through this experience together, this kind of collective trauma or collective experience. So I think the last question for both of you is really, should we be concerned about our long-term mental health? And, we've talked a lot about, people that are experiencing depression and anxiety for the first time. And, those folks may have kind of a short-term experience and may be able to move beyond it, but maybe not, should we be more concerned? And so, Dr. Francis, I'll let you answer that first, and then we'll have Dr. Kelly answer it. And then I'll let you both make one last comment and we'll wrap it up.
Yeah, so that's a great question. Long term, we're always concerned about long-term effects. So most depression, major depressive disorder, can be treated through medication and therapy. It can be something that is discrete and often doesn't recur. If it does recur, then there's a bigger chance that at different times in your life, you may have episodes from time to time. And it's really, we can help you if you are someone who does experience depression over and over during different times of their life. There are medications that are safe for you to use every day to prevent that from happening, or to lessen the symptoms when they do. We can also coach you, train you in different signs that maybe you're starting to have one of those episodes. And with early intervention, we can shorten the intensity and the duration of those illnesses, of those episodes of major depressive disorder. So really good to have early intervention for any type of major depressive episode, first or recurrent. And we can set you up with medications and therapies, and also some lifestyle coaching that can help. Anxiety disorders tend to be a bit longer, pervasive, especially after times of stress. Again, medications that are safe and effective to use every day, long term, without any big changes on who you are as a person, without changing your personality, and really helping you have your best life. Great evidence-based therapies for anxiety disorders. Some anxiety disorders, you don't even need any medication. The therapies are so effective on their own. So people with anxiety tend to learn to manage it chronically. And so that's a really big goal in mental health. What we know about mental health is if you don't address it, if you don't get help and support early on, then you are more likely to have experiences of depression, anxiety, or mental illness in general over time. So we can lessen that with early intervention, sometimes mitigate it completely. But we are seeing higher rates right now of major depressive disorder, recurrence, and anxiety disorders, more PTSD, more substance use disorders. So during times of disasters, any traumatic experience, we also see more incidences of intimate partner violence, child abuse. So really important to seek support for those conditions now in order to prevent their impact on your life later and your family's life later. So treating yourself is really going to help your family, help your children in the moment and also long term.
Thanks, Dr. Francis. Go ahead, Dr. Kelly.
Yeah, that's really great information. And I think it's really important to be mindful that, and often the best way to take care of our children is to first take care of ourselves. But I want to get back to your original question. I think it's important to pay attention to how much we think about the future. I think that sometimes if we think too much about long term, that we can get really wrapped up in potentially what that could be. Where I think often the best thing we can do is make sure that we focus on today and make sure that today is as best as today can be. And we focus on making sure tomorrow can be the best it can be. And use these skills that we've outlined today, and utilize the resources which you have access to make now as best as it can be, and with the hope and confidence that things will be better in the future, right? As long as we focus on today.
Thank you. Dr. Francis, any final words before we wrap up? We have just a couple minutes.
Yeah, I just want people to know that what you're experiencing is normal. We are going through something unprecedented. This is long. We are anxious. We are uncertain. We're tired, and it's normal. And you can still have an abundant, joyful life. And we are here to help you get that. And if your symptoms are getting to where you can't have the functioning that you want to in your everyday life, your families, your relationships, reach out. We're here. We're normal people. We're parents. We're loved ones. We're just here to help. And we have really good evidence-based treatments that are fast and can help end your suffering. So we're here.
Well, thank you for that. And thank you all for joining us today. Dr. Kelly, any last things you want to say before we wrap up?
Well, thank you so much for the opportunity to speak today with everyone here that's watching. I think it's a great opportunity to raise awareness. I think that this is part of that post-traumatic growth process that we can now, have these conversations about resiliency and about how do we manage with difficult experiences. Difficult experiences are a part of the human condition, and it's about how we learn how to manage those experiences and how to improve and move forward. And I think that we can all be hopeful and positive in that process while we protect ourselves, our families, and our coworkers.
Thank you. Thank you all again. Thank you to all the media that joined us today. If you all have any follow-up for us, please feel free to email myself or Leanne with any additional questions. And thanks again.